Is dry socket from oral surgery. Now what it is? So it is the most common complication after extraction. So after extracting the teeth, so this is the most common complication of it. Dry socket, it is a painful dental condition that sometimes happens after the permanent teeth extraction. So it is a painful dental condition. So this was a term which was given by Crawford in 1896. So basically it's like it is when the blood clot at the site of tooth extraction, it fails to develop, or it dislodges, or it dissolves before the wound has healed. So now as we know, this is your, now after extraction, there's this socket which is formed. So this socket, it is filled with blood and it forms this blood clot at the site of this tooth extraction. So there is this formation of blood clot at the tooth extraction site to protect the bone and the nerve ending. But now in dry socket, what happens is this blood clot, it's like it fails to develop, or it dislodges, or it dissolves before the wound has healed, and this is nothing but a dry socket. So normally a blood clot, it forms at the site of tooth extraction. So this blood clot, it serves as a protective layer over the underlying bone and the nerves ending in the empty tooth socket. So basically this blood clot, it acts as a protective layer. The exposure of the underlying bone and the nerves, it results in intense pain. And now this blood clot, it has dislodged. Because of that, the underlying bone, now the bone, so there is no protective layer on this bone and the nerve ending. And now because of this, your underlying bone is exposed and the nerves are exposed, which leads to intense pain. So dry socket, in this dry socket, the most common symptom is there is intense pain. The socket, it becomes inflamed and it may fill with food debris. Now this is an empty socket. Now the socket, it was with blood clot in a normal condition. But now this is an empty socket. And because of that, the food debris, it gets accumulated into this empty socket. Because of that, it adds to more pain. So this is nothing but this is a dry socket. So now the definition is, a descriptive definition is, so this is the whole definition which I have divided into parts so that you can easily learn this definition. So the first point of this definition is, it is a post-operative pain in and around the extraction site which increases it. So basically it is the pain which is occurred post-operatively, and this pain is in and around the extraction site, which increases in severity at any time between first and the third day after the extraction. So the pain, it increases in severity between first and third day after extraction, and it is accompanied by a partially or a totally disintegrated blood clot. So basically your blood clot, it has partially or completely disintegrated. That is, the blood clot, it has dislodged within the alveolar socket, and it is associated with or without halitosis, that is fetid odor. So this patient, they'll have very bad odor, pain. So this is the main thing. Now these all are the synonyms of dry socket. So it is also known as alveolar osteitis. Osteitis is nothing but inflammation of bone. So alveolar osteitis is inflammation of the alveolar bone. Then there is localized osteitis, post-operative alveolitis. So these all are the different names which is given to this dry socket. Now what is the etiology? What causes this dry socket? So the dry socket, it is caused by partial or total loss of the blood clot in the socket, and it can be multifactorial. First can be oral microorganisms. So there is presence of large number of bacilli and Vincent spirochetes, which was introduced. So this thing that the oral microorganisms is a etiological factor, it was introduced by Schroff and Bartel in 1929. First is this oral microorganism. The next one is there is difficulty and trauma during surgery. So when you're extracting the tooth, at that time there is trauma. So basically it's like mostly surgical removal that involves flap elevation, sectioning of the tooth and bone removal. It mostly causes trauma to that site, and because of that there is formation of this dry socket. Then the roots of the bone fragments, they are remaining in the wound, and it leads to disturbed wound healing. So this is nothing but if you're extracting the tooth, and if some of the bone fragments or the roots, they are remained in that wound, so it can lead to this dry socket. Then excessive irrigation or curettage of the alveolus after extraction. So it's like basically, so you have extracted the tooth and you're irrigating it excessively, or you're curettaging it. So in my last video for this surgical removal of impacted tooth, I have explained that we are doing this curettage, irrigation, but this should be limited to it. If you are doing it excessively, it can lead to formation of dry socket. So if there is energetic repeated irrigation, it can interfere with the clot formation, and basically we want that clot formation, and because of that only we are giving all those post-operative instructions. So as you know, we are giving post-operative instructions as the patient is advised to avoid gargling, drinking with straw. Basically it's because we don't want our clot to be dislodged. So this is if there is excessive irrigation, so there can be dislodgement of the clot formation. And again, violent curettage, it may injure the bone. So if you're curettaging it like excessively or violently, then it may injure the bone. Next can be physical dislodgement of the clot. Physical dislodgement are the things that we say, drinking with straw or spitting, gargling. So there can be this dislodgement of the clot. The next can be this oral contraceptive. So oral contraceptive is basically the estrogen which is present in the contraceptive pills. They may activate the fibrinolytic system indirectly, and this fibrinolytic system is basically, it causes this like dislodgement of the clot. So Cartrani et al., the probability, so he stated that the probability of the dry socket, it increases with the increased estrogen dose in the oral contraceptive, and that the fibrinolytic activity, it appears to be lowest on the day 23rd to 28th day of the menstrual cycle. And basically the females who are on this oral contraceptive, they are mostly advised to go for extraction from this 23rd to 28th day only, because the activity of this fibrinolytic activity is suppressed. The next etiological can be smoking. So it's basically you are like post operatively you suggest the patient. So suggest the patient to avoid smoking for 7 to 12 or 14 days till the wound it heals properly. So if the person he smokes, so it is like there is this formation of dry socket because the wound is not healed properly. And the incidence of this dry socket, it is found more 40% in the person who are smoking after the extraction. Then basically it is the result of bacterial, chemical, mechanical and physiological factors. So this can be the etiological factor, and all these are the factors that you can write in your exams too. So pre-existing, if there is a pre-existing infection, pericoronitis, mechanical can be sucking through a straw, aggressive rinsing, spitting, then dragging on a cigarette, then physiological can be hormones. All these are the etiological factor for dry socket. So this is nothing but if the age is less than 25, there is infection by Treponema pallidum, traumatic extraction, smoking, poor oral hygiene, and if the patient he has a previous history of dry socket, can lead to the etiology of the dry socket. The next is the pathogenesis, how exactly this dry socket forms. So after tooth extraction, there is this orderly sequence of the event which causes this normal tissue healing. So the alveolar socket, it fills with the blood that undergoes coagulation and contraction. So there is this order which is formed. So there is a sequence of event that causes this normal tissue healing. So first is your alveolar socket, it fills with the blood. Then there is angioblastic growth which occurs in this clot with the epithelium that covers the clot. Then the fibroplasia in the clot then ensures with the cellular elimination of the fibrin and blood debris. This fibroplasia, it helps that there is elimination of the fibrin, because this fibrin is basically nothing but it dislodges the clot. Then a variable amount of osteoid is then produced, that is the bone. Then the woven bone is formed, and which results in the mature bone formation by the osteoblastic and osteoclastic activity. In some instances, now there is this early clot formation. In some instances, you will see the blood clot, it is formed earlier, and basically it is followed by premature clot necrosis, and it is accompanied by pain and fetid odor, and that is nothing but the dry socket. So the partial or the complete lysis and destruction of the blood clot, it was caused by the tissue kinesis, which was liberated during the inflammation. So basically, if your tooth socket, it is inflamed, so this inflammation, it releases this tissue kinesis, and because of that, there is this partial or complete lysis and destruction of the blood clot. Now, there are these two theories which were given. First one is Bean's fibrinolytic, and next one is bacterial theory. So now, according to the Bean's theory, so after extraction of a tooth, an inflammatory process, it begins that could affect the formation and retention of the clot. So basically, according to Beans, he stated that there is an inflammatory process that begins after the tooth extraction, and it may result that affects the formation and the retention of the clot. So studies, they have shown increase in the fibrinolytic activity in the pathogenesis of the dry socket. So there were studies which were done, and it showed that the pathogenesis of dry socket, it there is an increase in the fibrinolytic activity in cases of dry socket. So what is this fibrin? So fibrin, it basically this disintegrates due to the effect of kinase, which is liberated in inflammation process. So as we know, now there is this inflammation process. Because of that, there is kinase liberation, and because of that, the fibrin, it disintegrates due to the direct or indirect activation of plasminogen, which affects the stability of the clot. So because of this kinase, there is activation indirectly or directly. There is this activation of plasminogen. So basically, this plasminogen, it is synthesized in liver and it is released into the circulation, and they are activated by the proteolytic cleavage. Then it forms an active form which is known as plasmin. So this plasminogen, it is activated by this proteolytic cleavage and it forms this plasmin. And this plasmin, it acts on fibrinogen and fibrin, and basically they causes this clot dissolution, and there is formation, and it forms number of fibrin degradation products. So this is basically the Bean's fibrinolytic theory, in which he stated that there is formation of plasminogen, which finally forms this active form which is known as plasmin, and this plasmin, it acts on fibrinogen and fibrin, and this causes the clot dissolution. But now there are this antiplasmin which inactivates the plasmin. So this is basically your fibrinogen. It is like your plasmin, it acts on this fibrinogen. But if there are this antiplasmin which are present, so this antiplasmin, they inactivate the plasmin into the circulation. And the bacterial theory, it states that the bacterial theory, it comes endorsed by there is existence of high count of bacteria around the extraction site. So there is this bacterial theory is nothing but there are many bacteria which is present around the extraction site, and the bacteria which can be present are Actinomyces viscis and Streptococcus mutans. So these all are the two main basic theories in the formation of dry socket. Now what are the symptoms? So symptoms is, first you will see pain. Then the next is pain, it is localized to the extraction socket and it will be sensitive to even gentle probing. So the pain, so the intensity of pain is severe. Then although the suppuration is not evident, a sharp pain persists and that increases with suction or mastication. Then halitosis is present, and basically this halitosis, it is because of the bacterial infection, systemic factors, and there is surgical trauma. So it is common for pain to radiate to the ear and one side of the head. Then there is partial or total loss of the blood clot, which gives this empty looking socket. So there is this loss of blood socket, and because of this, your socket, it looks empty. Then there is this telltale sign in there is this partial or total loss of the blood clot, and the jawbone may be visible in the socket. So your bone, it is visible in the socket, and the surrounding tissue may appear gray due to poor healing. So this is nothing but a telltale sign, which you can see in dry socket. Now what are the preventive measures? So first, what you're doing is a comprehensive history with identification of risk factors should be taken. Preoperative oral hygiene measures should be taken to reduce the plaque level so that you're reducing the bacterial levels. The next is the all extraction should be completed with minimum amount of trauma. So as you know, in Exodontia, the definition of Exodontia is also stating that you should extract the tooth with minimal trauma to the surrounding tissues, and there should be maximum amount of care when you're extracting the tooth. Then avoid extraction if there is presence of active infection or if there is ulcerative gingivitis, because in that cases the bacterial count is too high. So in that cases you should avoid extraction. The next is the appropriate antibiotic prophylaxis. It should be administered for difficult lower if there are difficult extractions, or if the patient he is immunocompromised, or the patient with a previous history of pericoronitis or ulcerative gingivitis. In that cases you need to give prophylactic antibiotic therapy. Then the patient who smoke, he should be advised to cease smoking preoperatively and at least 2 weeks postoperatively. The patient, they are advised to avoid vigorous mouth rinsing for at least first 24 hours, and they should use gentle tooth brushing and mouth rinses for 7 days. And the female patients who are on oral contraceptives, so the extraction should be done on the 23rd to 28th days of the tablet cycles. As I said, the fibrinolytic system, it is suppressed during this 23rd to 28th days. So these all are the preventive measures. Moving on towards the management. So the patient, he should be radiographed to exclude the possibility of retained fragments. So you are radiographing the patient so that you are excluding if there are any retained fragments which are present into the socket. The next is a significantly reduced incidence of dry socket. It was seen if you are irrigating the socket with betadine and if there is a topical application of clindamycin in the form of a gel form. So basically it was seen there is this reduced incidence of dry socket if you are irrigating the socket lightly with betadine, and if there is a topical application of clindamycin. So this is your dry socket. This is a empty dry socket. So what you're doing is you're applying this clindamycin in a gel form. Then the affected socket, it should be gently irrigated. So the affected socket, it is irrigated with 0.12% warmed chlorhexidine. And if the patient, he has extreme pain, in that case, local anesthesia is usually required. Then there is this use of whitehead varnish. This whitehead varnish is nothing but same like a topical application of this whitehead varnish. So it is a combination of iodoform, balsam toluene, stearex liquid, and there is this base liquid which is present in this whitehead varnish. So you can apply whitehead varnish in those sockets. Then there is this intraalveolar paste which consists of zinc oxide eugenol paste, anesthesia, and an antibiotic. So antibiotic, it can be metronidazole, and it is placed into the socket. So basically what you're doing, you're placing a strip of this paste which is soaked in a surgical gauze loosely in the socket, and you're not exerting pressure onto it. So this is nothing but a paste which is made up of, so your zinc oxide eugenol, as you know, it is a obtundant. So this is the obtundant, anesthesia, and antibiotic. So this is the paste which is made combining all this, and you are placing that into the socket loosely. Then there is topical application of tetracyclines, oxytetracyclines, and hydrocortisones, which has shown to decrease the dry socket cases. So you are just doing the topical application of tetracycline and hydrocortisone. Next is this alveogel. It is widely used in the management of dry socket. So this alveogel is the combination of butamin, eugenol, and iodoform. So this is nothing but the same like combination of anesthesia. Then there is this obtundant, which is the eugenol. Then next one is the antibiotic. Next is the topical use of para-hydroxybenzoic acid, that is PHBA, in a dose dependent fashion. It helps in decreasing the dry socket. Appropriate analgesia like non-inflammatory, non-steroidal anti-inflammatory drugs. Basically, you are using appropriate analgesias to reduce the pain. Then the patient, he is instructed in home socket irrigation using this 0.12% chlorhexidine when the dressings are no longer required. So if the case it does not require those dressing to be done with this paste, after that the patient is advised to do the home socket irrigation using chlorhexidine. And this is like the use of lasers has been proven to be beneficial in dry socket management. This is the newer technique in which you're using lasers. So laser biostimulation is considered a safe method of treatment, accelerating the tissue regeneration process and decreasing the stimulation of the pain. So this is a newer technique that is using the lasers for the treatment of dry socket. And this was it for this video. I hope you found this video helpful.